He said, I would give you anywhere from 6 months to a year to live if you don't have it.
I met Louis when he was in one of our research trials. I was the cardiology research coordinator, and Dr. Broderick was the principal investigator of the trial, and we recruited Louis to be in the research trial. It was for a new blood pressure medication. And the research patients are pampered, and we got to know him very well, and we became close friends.
See, I had 4 bypasses, 10 stents, a defibrillator put in.
With all this going on, it was a lot to take care of, but he was doing very well, or reasonably well with that. He was still sharp, but with the problem with his heart and the valve, that took precedence. In spite of all these advances that we were able to give him, he still had this serious problem with his aortic valve. With this serious valve condition, severe aortic stenosis, patients can die, and that's why the valve needs to be replaced.
What occurs in aortic stenosis is the valve function is interfered with, so the valve won't open effectively.
Dr. Broderick mentioned that he would benefit from having the TAVR procedure.
Our Premier Health Transcatheter Aortic Valve Replacement program is unique in Dayton, and it is the first program started in Dayton, and we're proud to deliver that to our high-risk patients.
One of the things about this disease, aortic stenosis disease process, once symptoms occur, the problem is progressive. Unfortunately, it's not static, doesn't stay stable, it always worsens over time, and invariably eventually leads to death somewhere between 2 to 5 years.
When Louis asked me my opinion of having this procedure done, I was selfish actually, because I wanted Louis to stay around longer. We'd become dear friends, and it was hard to watch him decline.
Dr. Broderick talked to me. He said, Louis, he said, you should have his procedure done. And a month and a half later, I went ahead and had it done.
There are many patients in our region who have been turned down for surgery, saying they're too high risk, and unfortunately we can't do anything for you, and that's not right. I was very concerned about his high risk for surgery and wanted him to have a safer, more effective procedure that he could live longer and resolve his symptoms and have a wonderful life and enjoy his family. We found that with TAVR, and he did beautifully.
It's amazing how fast he recovered, and that's the whole purpose of this type of procedure. It's minimally invasive, and the recovery period is very short.
I am 100% satisfied with the operation, what they've done to me. I would suggest if somebody had problems like I had, I'm not telling them, I would suggest they should do it, have it done, because it makes you feel 100% better.
It was exciting to hear the enthusiasm in his voice. He's like, I'm a new man, It really helped me.